Hi, in this video we will see a topic that comes under the newborn known as KMC care, that is Kangaroo Mother Care. Kangaroo Mother Care, it is a powerful and easy method to care the newborn in order to bring the physiological development of the newborn. And this will have a benefit for the mother also. They will have an attachment of mother and the baby. Keep the baby on the mother's chest to maintain a skin to skin contact, wrapping the baby around the mother's chest level. So what is the meaning of Kangaroo Mother Care? Kangaroo Mother Care, it is a procedure to make a skin to skin contact continuously by wrapping the baby in order to improve the warmth, increases the initiation of breastfeeding and early discharge from the hospital. So history, if you see, this was presented by Ray Benares in Colombia. Why? Because there that time there was insufficiency of incubator for the preterm baby care. So that time they have found this is an easy and cost effective method, and stable preterm newborns can be used this Kangaroo Mother Care, that is a skin to skin contact. This will improve the physical well-being of the newborn and better survival rate of the newborn in a cheapest and successful way, and they will facilitate much bonding between the mother and the newborn. As a result, WHO also recommended all the babies who are delivering below 2.5 kg or 2500 gram less can be initiated and work out this Kangaroo Mother Care in order to improve the health of the newborn and initiation of breastfeeding and early discharges whose the babies are in a cardiopulmonary or hemodynamic stable is there. Okay. And we will see, you know what is kangaroo. Kangaroo you all know maybe. This kangaroo, what happened when she delivered the baby, the small immature baby, the kangaroo will keep on her pouch. Okay, that kangaroo pouch. This will make the safety, prevents the injuries and promote the warmth of the kangaroo baby, and this will have a continuous breastfeeding for the kangaroo babies, and health of the kangaroo babies also will be very much good. So they are living in a very cold climate, no? So the same like this measures we can apply in our human being also, in the hospital setting or after discharge in the home setting they can practice this. So we will see what are the indications. Indication: normal newborns below the birth weight of 2.5 kg, and low birth weight babies like below 2000 gram or 2 kg babies, or severely low birth like 1500 gram also. And if the preterm babies, if the gestational age is less than 37 weeks on the birth time, so that babies, any sick babies, but their hemodynamic stable is condition is stable, means these type of babies we can go with the Kangaroo Mother Care. And what are the characteristics? In Kangaroo Mother Care, we have to place the newborn infant on the chest of the mother, and this will a continuous procedure for the mother from the hospital to the home setup. Then next they will start initiation of early breastfeeding and maintenance of breastfeeding, and maintain a bonding between the mother and the baby, and this should have a follow-up and support should be there. Support, who has to give support? Family members has to give a continuous support for the mother. And next one is, in a busy schedule of nursery or postnatal ward, this will minimize the workload of the staff, and cost effective method. So these are the major characteristics of Kangaroo Mother Care. Next we will see what are the components of Kangaroo Mother Care. Kangaroo Mother Care, mainly 3 components are there. One is Kangaroo Position, second one is Kangaroo Nutrition, third one is Kangaroo Discharge. So first we will see Kangaroo Position. So Kangaroo Position, in definition I told, the baby has to placed on the mother's chest as a result of skin to skin contact. Okay, the baby can be wrapped. So position, how the baby has to be taken and placed on the chest level in between the breast, and the baby has to be covered with a binder on the wrapper. So when the baby, what is the position means, upright or vertical position, and the head has to be turned to one side in order to give a airway passage and less obstruction for the newborn nose. And if you see one side the face is there, the baby can have a eye to eye contact with the mother, and bonding and psychological support will be improved. And next, if you see, when we are putting the binder, we should be it should not be more constricted to the baby. And if you see the dressing, the mother can use the front open dress with their own culture, and the baby can also go with the front open sleeves. So this the baby has to be maintain a flexed position like a frog like manner. Frog like position has to be maintained, and the hyperextension of the body and the neck has to be prevented by supporting the baby in a bottom by the hand of the mother. And next you see this will promote the baby has to be baby's abdomen has to be placed on the epigastrium region of the mother. Then next, baby abdominal breathing should not be constricted, and the baby discomfort should not be there while we are making this position. As an initial stage, the nurse can monitor the baby to find out the temperature is maintained, or any change of skin color is there, or any discomfort is there. So when we are placing the baby can be put caps, socks, and huggies can be kept for the baby. So this is the mainly position that is known as the kangaroo position. The newborn has to be placed on the chest of the mother in between the breast. Nicely they will get a skin to skin contact, and no other discomfort or obstruction or constriction of clothing should be there, and a binder or a wrapper can be covered around it, and continuously kangaroo mother can be given. Next one is Kangaroo Nutrition. Kangaroo Nutrition, if the baby is having the sucking and swallowing reflexes, then the baby can go with initiation of breastfeeding. If the baby doesn't have the sucking reflex, then next we can go with tube feeding or spoon feeding according to the demand of the newborn. So that when the baby is placed in kangaroo position, that time only we can go with the tube feeding for the baby. That is, the breast milk can be expressed and tube feeding can be given. And next, when the baby is attaining the sucking and the swallowing reflex, or able to suck from the breast, then we can initiate the breastfeeding, practice the mother, then maintaining and continuation of breastfeeding. So this is known as the kangaroo nutrition. That is the exclusive breastfeeding for the newborn. Then third one is kangaroo discharge. So kangaroo discharge means early discharge and give a support to the mother. So and follow up for the mother. So early discharge. So small babies can be discharged when the baby is attaining weight, adequate weight, that is 2.5 kg, and maintaining the warmth and stable conditions, and the mother is having confidence in taking care of the newborn, and adequate skill has achieved to promote the continuous kangaroo mother care, then we can discharge discharge from the hospital, and we have to advise the mother regarding the follow up. So once a week or 2 weeks once she can come and check the baby's conditions and check the weight of the baby has increased or not. So like that they can do the follow up, and we have to give an advice for the women, and we can give a advice to the family members to support the women in order to take care of the baby. It will be a continuous process. The mother has to keep the baby for 8 to 10 hours continuously. So the family members has to give a support for the mother. So these are the main 3 components comes under the kangaroo care. Kangaroo nutrition, kangaroo position, the next kangaroo discharge. Next we will detailedly see about what are the benefits. Benefits, one is benefit to the newborn baby, then next benefit for the mother, benefit for the family members, benefit for the hospital, and benefit for the nation. So first we will see benefit for the baby. Baby is physiological well-being of the baby will be achieved. Psychologically, emotionally baby will have an attached to the mother, and cardiopulmonary status will be improved. Mild respiratory distress such as apnea and oxygen supply will be increased when the baby is in a kangaroo position, and initiation of breastfeeding and growth of the baby will be improved, and thermal regulations and prevent the cold stress. Neurological behavior of the newborn will be increased, that is neuroprotector, the neuroelectrical impulses will be increased, sleep pattern will be increased for the newborn, and prevention of falls and injuries, and prevention of infections, and GI tract activity will be improved for the newborn. So there are many physiological and emotional psychological benefit is there for the newborn, and early discharge, successful growth can be maintained, adequate weight can be maintained for the newborn. So these are the benefits that comes under the newborn. Next we will see what are the benefits of the mother. Benefits of the mother, mother will be always stressed. So while giving the Kangaroo Mother Care, her stress level will be decreases. She will become the primary caretaker for the preterm babies or the newborn babies, and she will be psychologically benefited, more initial bondings, and this will be there. She can give a continuous breastfeeding for the babies. She will be satisfied, and her skills of taking care of the baby will be improved. So these are the benefits for the mother. Then next, what is the benefit for the family members? Socio-economically, it will be cost will be less comparing to placing in an incubator, and they have a psychological connections or a bonding between the baby with the family members, and early discharge of baby from the hospital also benefited to the family members, and they can give a care for the babies. Next one is a benefit for the hospital. Hospital, it is a cost effective method and less use of incubator, and less staff is needed for the procedure, and if you see, this will have a good morale, and good care can be given, and good counseling can be given for the mothers, and early discharge from the hospitals decreases the disease condition of the newborn, and they can establish a follow-up visits for the newborn. So these are the benefits for the hospital. Then next one is benefit for the nation. Benefit for the nation means this will decreases the morbidity and mortality of the preterm babies, and less cost we can achieve a good care of the newborns in the nations, and we can develop a good intelligence and healthy newborns for the future generation. So these are the benefits of the newborn. Then next we will see what are the nurses' role. Nurses' role mainly first one is assessment. Proper assessment is very much essential. Well, correct position is there, no constriction of clothing is there, adequate temperature is maintained from the mother and the baby, and the baby color is pink, and how the temperature is, whether the diaper is changing is needed, and we can give an adequate counseling for the woman. Counseling regarding how to maintain the position, and how to bring the skills of training of Kangaroo Mother Care, and after follow up also what are the visit the mother has to done, and when she go for bathing, then again she can come for continuing the Kangaroo Mother Care. Intermittent Kangaroo mothers, some babies they need compulsory incubator, but in between they can give Kangaroo Mother Care and feeding, then they can place the baby in incubator or ventilator. So like that teachings and counseling, and we can give the family members, they should give a support for the women to practice the Kangaroo Mother Care in the hospitals and in the home setup also. And duration, initially the nurse can help the mother to practice 1 hour duration, then change the conventional method. As the mother will get the regular skills, she can go with 8 to 10 hours duration of Kangaroo Mother Care practice, and this they can follow in the hospital also. And discharge, they can give an advice of the baby is healthy, weight 15 to 20 gram of weight should be increased per day, and the baby is sucking the breast breast milk properly and the baby is having adequate health, prevention of infection, maintained the warmth, then they can decide for discharging the baby from the hospital, and they can give an advice for the women. When to stop the Kangaroo Mother Care? The baby achieved weight 2.5 kg and the baby is discomfort while putting in a skin to skin contact, and they are pulling out the legs, they are crying, that time they can discontinue the Kangaroo Mother Care. If they are advised by the hospital, they can physician, they can continue the Kangaroo Mother Care whenever needed, when the cold climate anything is there. So these are the major nursing assessment and nursing care that comes under the Kangaroo Mother Care. So today in this video we have seen about what is Kangaroo Mother Care, what is the history of Kangaroo Mother Care, then what is the characteristics, what is the components, what is the benefits, and what is the nurse's role in Kangaroo Mother Care.